Thank you everyone for joining us again at a 227th meeting of LATIN-19. It's such a pleasure to see many faces that have joined us from the very beginning and some new ones. And I'm gonna start a little bit of a presentation on our 5th year anniversary, but I wanted to know if there are any announcements. Anybody, I kind of want to go back at the way we were doing it before, right? Remember, if you remember, some of you were here 5 years ago. If you remember, we will come together and say announcements and share things that were happening with our community and share concerns before I do my presentation, and then I will open it again for comments. But I would like to hear from you.
Oh, thank God.
Luisa, are you trying to talk or?
No, I'm so sorry. It just changed the audio y se me quitó el mute. I'm sorry.
No worries, no worries. Any announcement? Gaby Maradiaga, you were one of the first ones we met in here 5 years ago.
Hola, everybody. It's good to see this Zoom screen again. I don't really have an announcement. I was speaking to a group of students recently about activism and advocacy, and they asked me, was there a specific moment when you started Latin-19, when the whole thing began? And I said, there was. I remember very clearly that week when the ACC basketball tournament was canceled and Duke basketball was canceled. And I thought, okay, if Duke basketball is canceled, this must be really, really bad. And then I got the announcement that Durham Public Schools was closing. And that is really when the bottom of my heart sank, thinking of all of my patients, the families that I knew intimately, their names, their everyday lives. And I thought to myself, oh my goodness, what are we going to do? How are these families going to make it through this time? How are these kids? And so I went through this moment, not of panic, but of just realization of the heaviness, of the seriousness, which had been building, as Viviana has commented, because of our relationships abroad and internationally. We were very familiar with what was happening, and then it hit home. And when that Durham Public Schools announcement came out, I reached out to Viviana and the group, and I said, what are we going to do? And that's when we organized our first meeting, and Viviana coordinated everything. And so it's very clear in my mind that there was this moment really of community, which is what so much of the work of this group is about, is thinking about community and then working as community, right? Not individuals, not silos, but immediately turning to community and working together with community in solidarity to problem solve quickly, which is what our Comunidad Latina is so amazing at doing. And so as a moment of reflection of these 5 years, it's like it was yesterday for me, that moment, reading the email, all the feelings, the tension in the muscles, the sadness, the anger, and then immediately like, okay, what are we gonna do? ¿Qué vamos a hacer? Pa'lante. So thank you for giving me a few minutes to share that reflection.
Gracias, Gabriela. Jackie Hernández y luego Rosa.
Hola, buenos días, tardes. Yo quiero compartir que el día de mañana vamos a tener nuestra reunión mensual del grupo Latidos. Es un grupo de apoyo para padres con hijos neurodiversos como autismo, ADHD, síndrome de Down, etcétera. Nos reunimos una vez al mes. Es el segundo jueves de cada mes por las mañanas en persona en el Red City, que es ahí en el downtown. Y les quería compartir que mañana va a ser nuestra reunión. Originalmente, la original la tuvimos que posponer porque estuvimos enfermas, Pati y yo, que somos las que organizamos, pero lo vamos a hacer para este mes, el día de mañana, por si alguien quiere venir a visitarnos. Gracias.
Gracias, Jackie, por el anuncio. Me recuerda mucho cómo estábamos con la pandemia. Quiero también anunciar que Jackie ahora va a estar coordinando algunas de las actividades de de Bull City Strong, de educación de trabajadores comunitarios con Bull City Strong también. Sí, estoy muy, pero muy contenta de hacer ese anuncio. Y Jackie ha estado envuelta desde el principio, casi desde el principio de Latin-19 con todo, con la semilla también. Y gracias por lo que haces por los padres latinos de niños neurodiversos, es muy importante. Rosa
Sí,
Solórzano.
gracias, Viviana. Recordando hace 5 años, cuando todo se cerró y se abrimos las primeras reuniones, y recuerdo que por los testimonios que nos traía Iván Almonte, Jackie de la comunidad, solo y nosotros en casa, muy cómodos, siguiendo trabajando, con todos los privilegios. No, ¿qué vamos a hacer? Yo recuerdo que yo lloraba y decía, Dios mío, tenemos que hacer algo. O sea que gracias a Dios, esta puerta que se abrió con Latin-19 para podernos juntar todos los distintos recursos y los que tenían destrezas y los que conocían la comunidad, nos pudimos poner juntos a remangar las manos y empezar a trabajar para tratar de resolver este problema. Pero fue algo que si no hubiera existido en Latin-19, yo pienso que hubiera sido muy difícil poder atacar el problema que teníamos tan grande de COVID en nuestras comunidades. O sea que realmente Latin-19 nos dio propósito y sí, sentido de poder sobrevivir esa situación, pero propósito también de poder hacer algo juntos.
Gracias, Rosa, porque es cierto, es que tuvimos este espacio abierto, ¿no? We created this space for everybody, and it's un cable a tierra. I think of so many songs and so many ways that created the possibility for us to continue to meet. And then I see Luisa. And
Perfecto, perdón. Disculpen que estaba saliendo de un evento, pero ahora que escuché todas esas reflexiones me inspiraron y creo que en otras sesiones he mencionado lo importante que este espacio ha sido para mí, pero yo estaba nueva, recién llegada a Carolina del Norte. Y me acuerdo de decirle a mi esposo, es que estoy muy preocupada, no creo que vayan a haber suficientes latinos, porque estaba mirando el data de la comunidad latina. Y aún más asustada estaba porque no pensé que iban a haber dominicanos, etcétera. Eso estaba aterrada. Y me acuerdo de estar en este grupo, y I'm like, oh my God, there is. Hay comunidad, ay no, qué cosa. Y desde ahí no importa el trabajo, pueden ponerme a hacer cualquier otra cosa, no me interesa. Aquí estoy los miércoles con mi gente, sí o sí, y no, pues sí, ha sido como un grounding, una base, una fundación, y obvio también es una conexión demasiado importante para el trabajo que uno está haciendo, y nos provee esas herramientas y esa fortaleza para seguirlo haciendo, pero más que nada para mí es el sentido de comunidad, las amistades y las personas que me han podido dar apoyo, pues sí, como familia, de una manera que fue muy inesperada y muy agradecida o especial en un momento tan difícil. Pues estábamos todos.
gracias, Luisa. Luego Alicia y luego voy a hacer una presentación corta.
Bueno, buenas tardes a todos. Un momento de reflexión, quizás porque muchos de los sentimientos que ya se han expresado, todos los compartimos, todos hemos vivido este momento que tenemos como traumático recordando, pero también las cosas positivas que han salido. Y la reflexión es porque recuerdo una conversación con mi esposo, Eduardo, que es científico en este momento retirado, pero estaba muy activo en ese momento. Y todos pensamos, bueno, esto se resolverá, quién sabe, en unos meses o prontito. Y él me dijo una cosa muy seria en su momento. Me dijo, hasta que no tengamos métodos de diagnóstico para diagnosticar el COVID, tratamiento, vacunas y datos, no vamos a poder salir adelante. Y esta reflexión es un poco porque no nos olvidemos del trabajo que han hecho nuestros científicos y nuestros médicos cuando no había herramientas, no se sabía cómo realmente atacar de estos pacientes. Pero la reflexión es porque no podemos bajar los brazos en la lucha de defender a la ciencia, porque otra pandemia puede estar a la vuelta de la esquina y nuestra ciencia está siendo amenazada muy seriamente y creo que tenemos que seguir luchando y elevando los diálogos para estar preparados. Es la naturaleza, es la biología, es la evolución y habrá más pandemias, pero que hayamos aprendido de la pandemia que tuvimos y no volver atrás a luchar contra la próxima. Perdón que hace un poco la nota negativa, pero pienso que y aprender de lo que hemos vivido.
Alicia, lo que dijiste, y para los que no saben, Alicia es uno de los nuevos miembros del board de LATIN-19. Gracias, Alicia, por tu dedicación. Hoy, esta mañana, hace media hora, terminé una reunión con la Organización Mundial de la Salud. I just finished a meeting with World Health Organization. Because I am attending the World Health Organization, the World Health Assembly in May, as a representative of a World Organization of Family Doctors, just like I was doing in 2020 and in 2019 when the pandemic started. And just as I was hearing the World Health Organization talk about vulnerabilities and risks of this new pandemic that they had just identified 5 years ago, today was a very somber conversation about the impacts of the loss of funding of USAID and the significant global impact. And so it was a very sobering remark that, Alicia, your comments brought tears to my eyes thinking about what I witnessed this morning in this other meeting and in this preparation for the World Health Assembly, and what does it mean to go back to an assembly where so many programs have been annihilated, so many global programs. And yes, I am thankful that the US has often funded lots of these programs, or has convened, because scientists from the US have convened and helped with lots of these programs. And to see the real dismantling of all of this is a real threat to humanity, I really think, and especially a threat to health. And so, yeah, it's a different type of pandemic, and it's the risk of new infectious rising problems as well. So I'm glad we're here, and I'm glad we're here to share. And some of you are new and haven't joined before. For some of you, some of this presentation will be familiar, but I want to share a little bit of what we have put together through the years. And Gabi, I know that you're going to be familiar with some of the slides. And let me just make sure I do this. And I need to do one more thing here. All right, is it showing okay? Yes. So, good noon. I wanted to share about the 5 last years, looking back, and then work together with you to see what's happening, going forward. As some I mentioned, LATIN-19 was born in March of 2020 out of a collective passion to support the Comunidad Latina. When understanding factors of vulnerability, we anticipated how much our community will be affected by COVID-19. And when we talk about factors of vulnerability, some of you had already mentioned, let's look at this WHO reminder of what are factors that increase vulnerability. What communities are likely to be more vulnerable are those who work in overcrowded or insufficient infrastructure, those who have lack of clean water and sanitation, those who are highly dependent on informal economy and daily wages, those who have poor access to healthcare services, those who have food insecurity and malnutrition, those communities who are marginalized or underserved, whenever there is armed conflict and violence, and when there are weak systems of health that support health, social infrastructure, and governance. And as a group, as a population, unfortunately, we could check off multiple factors that led to the increased vulnerability of our community. But at the same time, the community was also encountering weak systems for health in government. If you remember, when the pandemic started, it was a time of significant ICE raids and ethnophobic and anti-immigrant xenophobic policies and anti-immigrant sentiment, that otherness of a population not recognized as essential to the economy of the state or of the country. Sounds familiar? Right? This is where we were 5 years ago, and it's very similar to where we are now. And among the many factors that place the Latina community at risk, many were tied to their economic contribution. If you remember, the majority of members of our community were essential workers, not working with PPE, not working with protection. And also those factors like the family togetherness and support that normally offer resilience, because as we were mentioning, being together has added to our resilience, but in the case of the pandemic, contributed to further viral spread. And as we had worried since our first meeting, since when Gabriela said, oh my God, Duke cancel the games, the schools got closed, what's going to happen to our families? Exactly, the COVID-19 pandemic highlighted those deep inequities that were affecting it. And it became a headline in many networks, pandemia, Latinos in crisis, right? And so we started these meetings of LATIN-19, and I have to say that as a host, I was really taken by beautiful surprise. I would say it was a beautiful surprise to see how many of you showed up, how many representatives of multiple disciplines, academic institutions, healthcare systems, public health departments, public school systems, community-based organizations, government, faith communities, businesses, the Latino Credit Union, the press, and how many foundations started coming in. And more than 1,800 registered participants were coming into these meetings. Some of our meetings had 140 people. It went back and forth, but this is what we started, where we were. And then soon after, we conformed our first leadership team. This was our first board and I would want to highlight Gabriela Nagy, who was in psychiatry, who actually coined the name LATIN-19. We were trying to figure out, what are we calling this? And then she was the one at first, well, how about Latinx? And I was like, I personally had never heard the word Latinx with the X. And then we went, and then this was the first initial board. And then later on, new people joined us. And Rosa Solórzano, thank you so much. You were in the board in the interim from that initial board to the current one. And then Andrea Toomey and Gabriela Plasencia joined us in, I think it was late 2023. And then some others changed. And then Alicia Rico Lazarowski, Mariana Rodriguez Pardi, and Perla Núñez just joined us, where we got started, and we had our first meeting with them this last a couple of weeks ago. And this is our current board. So we have Perla, myself, Alicia, Pablo Friedman, Gabi, and Mariana. And this is where we are today. Now, we have always continued to use that syndemic approach that Rosa Gonzalez Guarda in the School of Nursing kind of brought us to. That syndemic orientation is what a way to understand and integrate these multiple epidemics that are affecting the community, the structural and social drivers, and as well as the factors that improve wellness and resilience. What is in the bottom? What is that's helping the resilience of our community? Is that familismo, ethnic pride, social support, the optimism? I have to say that during this last month and a half or 2 months, I've been very stressed about our country and the world, and it sometimes is meeting con la comunidad latina, is meeting con las trabajadoras comunitarias that actually end up with hope, because they remind me of la importancia de nuestra resiliencia. They remind me of the pride that glues us together. You know, sometimes listening to Yolanda Zavala, listening to Jackie, to Ivan, and so many others, I really end up thinking, okay, resiliencia is going to help us. But we also need to remember that sometimes being an immigrant ends up acting as a chronic condition, that it is so difficult sometimes is to have our heart sometimes split between where we came from, the choices that we made, and the being here. And it's much more difficult, and it becomes more chronic when there is that otherness, right? This compounding issue of telling us that perhaps we don't belong when we know we do. You know, we know, but there is acculturation stress that can be sometimes very difficult to handle. Now, kind of setting that, I'm looking back to the first initial year, we organized free testing in neighborhoods and parking lots of businesses that were frequented by the community. And we provided guidance to people that were testing positive. There was such limited amount of information initially. And we were very lucky to have partnerships and receive small grants from the Hispanic Federation, for example, and the KB Reynolds Charitable Trust that help us start doing vaccines. And of course, NCDHHS and Youth Health that provided us with vaccines and with guidance that we could give to the community, and especially the free rapid COVID tests. You know, to me, it was so important to have the North Carolina Department of Health and Human Services line to get more testing out, right? And be able to work together with multiple different organizations to share and bring around all of those. Now, the vaccines brought us all hope, right? Those vaccines that save so many lives, and to be able to bring them to people where people frequented, where people were working, again, partnering with multiple organizations early on during the pandemic to inform and vaccinate. This is one example of the many different times when we met. That day in the Cooperativa Latina Credit Union, we vaccinated in several different settings in Raleigh, 3,500 people. And we coordinated together with Wake Med, with the Catholic Charities and the Catholic Church. We coordinated events in churches and the Latino Credit Union. Working with community health workers expanded our health systems reach, right? It was very clear that health systems would not have been able to do the amount of work and to reach community if it wasn't for the work of the community health workers. We, as LATIN-19, became involved in the training of community health workers, both in person and on Zoom. And during the trainings, the community health workers taught us how to best address social drivers of poor health, how to really, really improve the health of our community. And then to increase trust, we hit the airwaves informing community, from showing initially the importance of testing to then and how to care for COVID-19, to then the importance of getting vaccinated, to a soccer analogy. Gabriela Maradiaga did this wonderful soccer analogy, to many cafecitos with Jasmine Rico, who was our state director of Latinx and Hispanic policy and strategy, to a taco and enchilada analogy showing during the World Cup games, to then partnering with Isla to create the Latinx Youth Ambassador Program that Jennifer de Costa Lopez and Gabriela Maradiaga Panayotti led, to communicate directly, to teach youth to communicate directly with families in their communities about the vaccine and how to help stop the spread of COVID-19. Another big success that it wasn't just ours, but we influenced, and together with Leonor Corsino and many others within the Duke health system, was to end up with a portal, Duke My Chart in Espanol, not a Google Translate Duke My Chart, but a real My Chart in Spanish, and the opportunity for people to actually have then a phone line, Duke en Español is also being part of this work. And we're going to hear from them, I think, in mid-April, because there's more coming that we really have impacted and continue to influence in our health system. Another thing that I think was a secondary effect was that the awareness of what was happening in the Latino community created the real importance of the need for more Spanish-speaking clinicians, more Spanish-speaking people working in medicine. And this contributed to increased interest among medical students to attend the advanced clinically centered education in Spanish classes that Leonor Corsino and Lisa Genao were doing at Duke, and a recruiting point for Latino students to the School of Medicine. We also invested in education for health equity through population health improvement projects for residents, undergraduate, and graduate students who worked on testing access, vaccination equity, and food security for comunidades Latina. And these Duke Bass connections have continued to evolve. We still have had more of those grants. We got recognition, and it was really great to be able to connect directly with the governor and with Mandy Cohen, who was the Secretary of Health, to be featured in a documentary by Univision, Victoria Boloveses and Andrea, last name escapes my name, did a great documentary. And even got recognition from the World Health Organization, where Dr. Tedros, the Director General, said the real heroes and heroines of the pandemic are all the health workers who are tirelessly working to both help their communities and amplify their voices. Muchas gracias, Vivi and BND and Latin-19 por ayudar a la comunidad latina a protegerse del COVID-19. I was like, that blew my mind. And then I heard that I got an email from the World Health Organization that they were looking for models, and the Latin-19 model had come up as a model to help. In 2022, we started also with monkeypox vaccination and information events vaccinating at El Centro Hispano in partnership with Lila, La Semilla, El Centro Hispano, the Duke Department of Family Medicine and Community Health, Duke ID, and Duke Health. And then one of our biggest prizes was how we ended up really getting access to vaccinations for our community, right? In this graph published in Health Affairs, the percent of vaccination recipients that were Latinos during regular vaccination events was about by Duke was just 2 to 5%. And then when we partnered with multiple other organizations, we went to 30% of the people vaccinated were Latinos. But if we did this in Latino trusted organizations, then we will end up with 80% or more of the people vaccinated in an event being Latinos. And then we ended up by the end of, I believe this was 2022, that the most likely to be vaccinated in the state were the Latino population. And that was really a big work done by our collaboration, our partnership. By using these multi-pronged approaches, creating safe spaces. But then as the pandemic evolved, the community shared with us about serious mental health problems, right? And this was one of the meetings that we had at LATIN-19 and share about all the different training that people were asking for. And again, this doesn't it sound familiar? This is a lot of what we are hearing right now, unfortunately. Again, there's this new uptake on these similar concerns. We recognize the immense need for mental health access and training in the community and partner with Duke's Office of Durham and Community Affairs to obtain grant funds to support El Futuro to train community health workers in hopes of alleviating the mental health crisis. And it was great to see this program where they ended up training over 426 community health workers around the state, providing 38 hours of training, and really doing this in 39 counties. We also started another effort for inclusivity was the LATIN-19 Community Consultation Studios, together with Duke Clinical and Translational Science Institute, where researchers could have a listening session with LATIN-19 community participants who served as experts and provided feedback to their research projects. Now, this was a grant that no longer exists and no longer funds, but we're hopeful that through our efforts that we can start doing these LATIN-19 community consultation studios again. We expanded to multiple key initiatives. And we say key initiatives, yet there are so many, right? We continue to do the multi-sector interdisciplinary convenings every Wednesday at noon, or almost every Wednesday at noon. We're doing a lot of mobile testing, and what we are doing now, because now we have access to tests for people to take at home, we continue to share testing for people to take to the home. We just don't do the mobile testing units. We did a lot of vaccines. We continue to do vaccines this year. We provided vouchers and Sharon Munoz led vaccination events for the Comunidad Latina in 7 or 8 different counties around the state. Continue to work on mental health research. We worked a lot about insurance, the access to Medicaid and ACA plans. We had continuously collaborated with the North Carolina Department of Health and Human Services and all of their many efforts, the brain trust and the meetings of, how do we continue to get access for our community, right? Continue to support health workers and navigators, the advocacy. We did the youth ambassador programs, and we haven't continued that. Again, funding has been the most difficult thing to come by. Working on health literacy, we did some patient safety, quality improvement as well. The Bull City Strong grant and initiative, amazing grant from the Office of Minority Health to the Durham Department of Health, really help us to not only hire a health literacy coordinator, but support the training of 80 community health workers in several different cohorts to learn about health literacy, distribute information to the community. We had people that were representative from several countries in Latin America who really learned. Many of them went on to do the community health worker certificate at the local community college. We shared, countless health literacy bags, COVID-19 tests, N95 face masks, and engaged for more than 70,000 people overall through the 2.5 years of the project. We also had a small grant with the American Heart Association, where we did health literacy assessments in Durham and in Raleigh. Also addressed hypertension disparities in the Comunidad Latina, provided 30 blood pressure cuffs with hands-on training and follow-up care with community health workers for people that were being diagnosed with hypertension and getting connected to resources, and also increased awareness and self-monitoring among the participants. LATIN-19 partner is one of the partners of the FIEL&C project that is that started between Departments of Family Medicine and Community Health, Pediatrics, School of Nursing, Margolis, with a great grant from the KB Reynolds Charitable Trust that is now on its third year, and we continue to do the work. We partner with the Hispanic Federation on their Línea de Salud North Carolina program, really getting access to communities across the state. And yes, several people have asked me, can anybody use the Línea Salud, regardless of their immigration status? They will have guidance to be able to get access to healthcare. Gracias, Olivia Peña. Olivia is one of the undergraduate students who has been working for me to do some updates on the webpage. I meant to put a picture in here, and I ended up running out of time because of the meeting I had, but gracias, Olivia, por el trabajo que estás haciendo. Olivia is an undergraduate student that one day just started sending me messages, and she was a Tábano, just like we always talk about, you know, Doctora Martinez-Bianchi, I would love to help and participate. So thank you, Olivia, for the work you're doing.
Of course, thank you guys for letting me come here. Sorry, I was just gonna say thank you guys for letting me come on here.
Yes, it's been such a pleasure to have you help, and if you all go to the website, you will see some direct resources that she has helped us upload. We are happy to announce that we have now been funded by the, I have a typo there, the KB Reynolds Charitable Trust. We couldn't be happier. This is our first capacity building grant that is going to allow us to continue to grow the work. We have never had an executive, we have had an executive board working as volunteers for a very long time. And this is going to allow us to recruit a part-time executive director for LATIN-19 to continue to do this great work. So thank you. I think Madison Allen was earlier in the meeting. And thank you so much for the KB Reynolds Trust for your support, or for your intentional support of the work of LATIN-19. So just remember, something to remember is how multi-sector partnerships are an empowering process for health equity. It goes without saying that none of the work that we did could have been done without the support of people, in those who are here today and the many who join us during the multiple meetings. An illness in the community requires a response in the community. We hope then, this was a drawing created by my friend Fernando Miguez from Argentina, who illustrates a lot of my talks, that unidos somos fuerza, somos muchos en la primera línea. And at that time is that we were hoping that to never go back to the old normal, and that this was our opportunity to make a big difference. And I think the old normal was this not recognition of the impact of the Comunidad Latina. The old normal was not having information in Spanish for la Comunidad Latina. The old normal was not identifying the significant contributions of immigrant communities, and I worry that the old normal may be back, although the new normal is that we're here and that we continue to do this work together. And I hope that this continues. Indigenous and immigrant, indigenous, born in the US and immigrant, together we stand tall. Our histories are relevant. An injury to one is an injury to all. And this is how I hope that we always see this, right? Like it doesn't matter whether Maria, Jose, Viviana, Alicia, or Gabriela are injured, that it's an injury for the whole community, whether it's Peter, John, or Jose, it's the injury of the whole community. And that we need to work together to improve health of everybody. And continue to be tábanos. And tábanos is the Spanish name for horseflies, is that being relentless in the pursuit of health equity during the pandemic, but beyond, right? And that we need to continue to hold ourselves and leaders accountable. The data supporting our claims. And I know the mechanisms of collecting the data, Alicia, are at a risk. And scientists are at risk of not being able to collect the most important data, but we need to continue to do and remember that no matter how difficult it might be, we need to hold those values of the importance of counting everybody close to our heart. The data will always support the claims that we're showing, the different disparities, and that it takes all of us together to make a difference. And so I would love, and I'm sorry I went a little too long and we have just 15 more minutes, but I would like to hear from you about what do you think is important for the future of LATIN-19? I think sustaining health, these are some of my initial thoughts for today, sustaining health equity efforts, continue to expand access, continue to expand access to Medicaid, to ACA, to the information on health, right? Continue to strengthen partnerships with hospitals, universities, policymakers, strengthening community health worker programs. Jackie Hernandez made a very important question at the day of the new Duke Center for Community Engagement meeting was, we continue to train people to become certified community health workers, yet we don't have enough jobs for them. How many more people are we going to train without an access to jobs, right? Can we implement a path to work for all these community health workers that are being trained? We need to continue to enhance research and data collection. We need to continue to strengthen voices Latinas in policy and healthcare. And then I leave you all with the what else? ¿Qué más queremos ver? ¿Cuál es el sueño? Gracias. A ver, ahí veo a Luisa con su mano levantada. I see Luisa's hand.
Sí, pero está bien, sí. Sí, pero está bien. Si alguien más quiere ir primero, yo era solo como estaba manejando que me entró una idea.
Dale, you were the first one. Go for it.
Beautiful. Thank you, Viviana. First, I want to say I was almost crying as you were sharing about the KB Rattles. I'm so excited. Congrats. I know how long and hard fought this has been, despite all of the amazing work that this coalition has accomplished. So I'm really proud to hear that and excited. Sorry, I'm going to switch to Spanish. Para mí, lo más esencial, además de todas las áreas que ya LATIN-19 se ha destacado y ha estado trabajando, creo que algo poco distinto o que tal vez no sea nuestro fuerte hasta ahora sería hacernos expertos en buscar fondos de nuestra misma comunidad y como siempre he pensado mucho en la manera que uno puede recaudar. ¿Me escuchan todavía?
Sí.
¿Aló?
Sí.
Okay. En la manera que se pueda recaudar dinero, que no tenga que ser como con condiciones. So, antes de esta época en la cual estábamos, yo pensaba, ok, me gusta non-restricted funding. ¿Cómo puedo encontrar funding que no tenga tantas reglas, que esto y que lo otro? Pero ahora que estamos grupos como este, que están específicamente marcados con cruz para eliminar o para fundar, ¿cómo podemos movilizar el dinero y el acceso que existe dentro de nuestras mismas comunidades para acceder a ese wealth? Porque tenemos entre nosotros mismos expertos, doctores, personas que tienen conocimiento en diferentes áreas, y también en esa misma forma tenemos personas de todo tipo de clases y acceso. So, hablando de acceso a dinero, ¿cómo, y dentro del mismo LATIN-19 sabemos que hemos hecho fundraising antes de pedir, ok, vamos a ponernos $25 al mes o algo así, pero ¿cómo podemos supercharge esos esfuerzos y crear esa independencia y esa fuerza financiera para poder ser el respaldo del resto de esos programas, aunque ya no le quieran dar los fondos? Ese es mi call to action. ¿Cómo hacerlo? Tengo que hacer un brainstorming después, pero creo que va a ser súper importante.
Yeah, you're talking about training for community-based organizations on how to write grants, how to develop fundraising, how to, and I know that.
But for us too,
yeah,
for LATIN-19.
Yeah, thank you, Luisa. Any other thoughts? Many things. ¿Qué tenemos que hacer? What's missing? What strategies? Luis, ¿quieres hablar?
Sí, quería hablar rapidito.
Sí.
Nomás en contribución de la conversación, en tratar de siguiendo movilizando y sabiendo cómo tener estas conversaciones. En mi personal experiencia también, como cada vez cuando estoy hablando con diferentes familiares, de saber cómo les puedo ayudar en saber también sus derechos ellos mismos, en también en el clima que estamos viviendo ahorita en este país, y también saber cómo educar a cada uno y las diferentes estrategias de tratar de empezar con los básicos, pero de también seguir diciendo como algo que les puede reducir ese tipo de ansiedad y frustración, porque hay muchos en nuestro estado que están teniendo este tipo de fear and anxiety, y o just teniendo una charla como breaking bread, con un cafecito con ellos, y eso es algo que para mí yo pienso que estuviera una buena estrategia y una buena idea para tratar de mover y movilizar en ese aspecto para nuestra comunidad.
Gracias, Luis. Veo un comentario muy importante de Yolanda. Yolanda, ¿lo quieres decir o quieres que lo lea? Yolanda Zavala.
Léalo, por favor.
Yolanda dice, mi sueño sería que todos ustedes que están organizando y son una fuerza fuerte de trabajadores de la salud fueran aliados cuando en la asamblea están sacando muchos proyectos de ley anti-inmigrantes, hacer todos un día de cabildeo. Yolanda is asking us to be at the assembly, and I think about this a lot because there are certain issues that lobbying is not allowed for community-based organizations, but people as independent people are allowed, right? And so what is lobbying and what is marching? I used to, and I also see the moment of vulnerability, you know, what is it allowed at this moment? You know, I don't know. I spoke at a march, at several marches before, and now I'm feeling constrained. Pero la comenta de Yolanda es muy importante. Vivian, were you up thinking of speaking? I saw. No, okay. ¿Qué otros comentarios? Elizabeth, Daniel, people who are working in, oh, Vivian, music, yes, sí, music.
Hi, well, since you called on me, I will share. I did like that you were interested in getting participation in research. That's something I'm interested in. I know another time we're going to talk about kind of cancer research and that kind of thing. That's an area of interest of mine. But I definitely, I'm involved with some research at Lineberger, and they're always looking to have at least fair representation based on the population of North Carolina. So we know how many Latinos are here. We want them in trials. We want them to have access to some of the same, to be part of the research, but also have access to resources. So I'm glad that you had that in your slide of priorities.
It is a priority because there's no enough data about Latino communities. And I also get tapped by different research teams on a regular basis. And it's not in their, even in their budget to have interpretation or to have community engagement often. And so, we want to be able to help with that in a way that is formative and also that really conforms to cultural norms of the community and to inform the Comunidad Latina as well. We have 4 more minutes only, 3.5 more minutes. Daniel, were you?
Did you see my comment?
Yes. So Daniel mentioned, would love to see primary care utilize community health workers more. Most PCPs, most primary care providers have no idea how to work with community health workers or what they can do. So there is a knowledge barrier among primary care providers. I know reimbursement is a barrier as well. Yeah. Yeah, and this is an issue that is very dear to my heart because all around the world, community health workers are used in health systems. But my personal, this is Viviana speaking for herself, although I'm in a video with the World Organization of Family Doctors saying this, the issue is that a lot of the time the community health workers are used and not paid enough, right? I've seen it in Africa where the whole health system, primary care is managed through community health workers who are paid 1 lunch a month. And that's not fair either. That's not fair at all, right? So how do we work providing community health workers a meaningful job to be able to work full time in this? It's a next step, right? But we need them. We need, there are not enough clinicians understanding really what happens in the community. I agree with you. The last 2 minutes. ¿Quién más? ¿Algún otro comentario? Gaby, te veo inquieta. ¿Qué más tenemos que hacer?
I think the other thing I would say, and we have been reminded of this from our different speakers, is that our community has a lot of power, and sometimes we don't use it to the max. And that means getting those who have a voice and want to speak up to speak up. That means going out to vote. That means getting people who are eligible to vote but not sure out there. That means putting Latinos out there on the ballot. That means supporting our candidates financially, volunteer hours, whatever, to be out there. So you sort of in line with what Luisa was saying, how can we acknowledge the incredible wealth of resources, expertise, talent in our community? And I use that broadly. That doesn't mean just Latinos. I mean our comunidad widely, so that we can continue to use our talent, our power, our resilience for the benefit of ourselves. And I really feel strongly about the voting and teaching, helping our community understand what candidates are out there and what they represent, and using the power of the ballot to put into office people who will advocate for what our community wants.
Thank you, Gaby. I see some more comments on the chat, and we need to close because Murtado has to go and interpret in another meeting. Pero muchas gracias a todos. There's so many reasons for which we continue to do this, and we continue to get together. And it's our 5th year anniversary, and we are going to continue to do this work because our community lo necesita, porque nosotros lo necesitamos, ¿verdad? Todos necesitamos y todos vamos a seguir haciendo esto. Abrazos y besos a todos. Muchas gracias. Y si quieren hablar de sus programas, comentar, etcétera, no dejen de comunicarse con nuestra línea Hola. Hoy no la mencioné a Lía, que hace tan buen trabajo para LATIN-19, haciendo todos los calendarios y la importancia de organizarnos para estas reuniones. Hasta luego. Adiós. Bye bye. Chao.